so much.
Awesome. We've got an amazing show for you tonight. We got all kinds of great guests. We have a doctor, and we know how hard those are to see. So,
and as two comedians, he's going to make us feel like shit because he did something with his life. That's fantastic.
Hey, laughter's the best medicine.
That is true. That is true.
So, we didn't study because we didn't have to.
Yeah. And who are we anyway? Who are we? My name's Lou Perez.
I'm Toby Muresianu. We're your co-hosts of Unsafe Space. And today we'll be talking about the healthcare system, all things medical related, and we've got a great lineup. And we always like to start off with a little bit of stand-up. So,
how do you guys feel about that? You want to hear a little bit of stand-up? Yeah, put your hands together. Keep that energy going for my co-host, Mr. Toby Muresianu, everybody.
Thank you so much. Hey, thanks. It's so great to be here. Quick poll of the audience. If you have health insurance, clap. If you don't have health insurance, don't clap. It's not worth the risk. I have Obamacare. That's what I have. Well, that's what people say. But Obamacare is not actually a health plan, which was disappointing when I found that out because I thought my doctor would be Obama. But what I actually have is a Medi-Cal, which was expanded under Obamacare. It's basically free health care that you get if you earn under $20,000 a year, which I am really good at. But it's a little bit nerve-wracking because I'm actually pretty close to the cutoff, not trying to brag. But it's a weird system because if someone offers to pay me $1,000 for something, I have to be like, sorry, I can't afford that. It'll cost me $1,500 next year. I didn't always have Obamacare. Before I had that, I had catastrophic health insurance. I don't know if you know what that is, but it is a sign of how fucked up the health insurance industry is that they can sell a product with catastrophic in its name. You would never fly catastrophic airlines. But somehow we make an exception for healthcare. The way it works is that it covers nothing until about $10,000, and then it covers everything after $10,000. So if you're get hit by a bus, you're covered. And if you get the flu, you just wait till you get hit by a bus. Right. It isn't very good, though. It was about $90 a month that it was costing me, and you get a free annual physical with that. So I was like, okay. So I searched for the doctors that were part of their network, and then just for due diligence, I searched on healthgrades.com to see what the reports were, and every single one of them had been disciplined by the state of California. I mean, how crazy is that also, that every taco truck in Los Angeles had to put its health grade right in the window, but for actual doctors would make you go onto a separate website. It's a bit ridiculous. So what I did, I was like, I'm not going to go to those doctors. I'll just find a doctor that I want to go to and see if they'll take my insurance, right? So I did. I went to UCLA, Ronald Reagan Medical Center, and I got my annual physical, and as part of it, they said, do you want a blood test? It's been a while since you had one. I said, sure. I took one. It was fine. And then 3 weeks later, I got a bill for $850. Yeah. So fortunately, I have a friend who works in the medical billing industry, and she said, where did you go? I said, Ronald Reagan Medical Center. And she's like, don't go to a hospital named after a Republican. So fortunately, she told me how to challenge it, and we got it dismissed. And I just think it's crazy that in the most advanced country in the world, our healthcare system depends on knowing a guy. That's a bit ridiculous to me. But anyway, that's my time. I want to give a quick bow now to the person who helped me with that medical billing, because she's right here. Lizzie Pelcher, give her a round of applause. Yeah. And that's my bit. And I'm going to bring up your next performer for the evening. He is a Canadian who we caught in the wild. He's an extremely funny guy. He was named the best stand-up in Toronto. He's nominated for best comedian at the Canadian Comedy Awards, and all sorts of great things. Give it up for Dave Merheje.
Thank you, man. That was all very beloved and kind. I appreciate that. Cool. It's weird too because usually it's in the dark when you walk up the stage. Like nobody could see you walk up, and then it was lit. So I was worried in my head that you guys were gonna see me walk, and then judge my walk. Is that making sense? I was like, if I don't walk dope, that's what I was going through. Those 2 steps there. That's what was in my head. I was like, if I don't walk dope, they're not gonna respect me. And then I try to like walk, then I changed my walk. I was just like it was just weird. I don't even walk, like I was creeping up, and then the more Toby got nice, the more I felt like insecure, and then then I just had the shittiest walk ever. I was like, if they see this, there's no confidence at all. They're gonna be like, I don't want to listen to this guy. But then that reflects, I think, Canada sometimes. That's why I feel. That's Canada, like in a nutshell, as a country, is like that. Are you from Canada? And you're like you just buckle. I only buckle in America. Like if I go somewhere else and they're like, you from Canada? I go, yes. But here I'm like, are you from Canada? I go, I don't know. And it's like I almost fade out of the conversation and the spotlight's gone. They're like, what the fuck happened to that guy? I remember being at the airport and the dude just a random dude goes, hey man, where you from? I go, Canada. And he goes, Canada? Like he goes, Canada? Like he just lost his mind. Canada, for real? Canada? Like he just said that for like 4 minutes. I was like, then he left. Like he walked away. Because he acted like Canada fell off as a country. And then I reminded him. That's how he responded. Canada, it's still there. Like it's the same way if I told him that Ja Rule put an album out. That's how I feel he responded. And I'm a Ja Rule fucking fan. I'm very petty. Like I care too much about rap, like backstory. Like a rapper's backstory. I care too much about their backstory, and my friends have had enough. Like I've ruined like conversations at parties. Like I can't even pick up chicks because like at a house party I was talking to this girl and then she goes fuck Ja Rule. Like I lost it. Like I don't know how to explain it to you. I was like, you mean Jeffrey Atkins? And that's bad when you know the real name. I was like, you can't. When you start saying the real government names, and she goes, who? I go, Jeffrey Atkins, Ja motherfucking Rule. He was the first rapper to rap out of a backyard pool. Like I was just so mad. Like, he was, man. Do you know how hard it is to rap? Like he came out of a fucking pool. But this is the part that blew my mind. Like he came out of the water with a rap already. Do you know how hard it is? There's water in your mouth and he didn't give a fuck. Like nothing was wet and then he rapped all the way to the barbecue. It was so ill. Also, before your polite laughness is not even a word. That's not even a word. Because they can't see you. You're laughing, but not out loud. But dope. I don't know how to explain it. Like the whole time I'm watching them and I'm watching you, you're laughing with like a gentleman. Like I don't even know how to explain. Like exquisite, I guess. Like you're just like you're like maybe. Like you keep saying maybe with your laughter, it'll go out loud. Like and it's making me work harder because I'll be here and I'll look at you. I go, oh fuck, I gotta turn it up. Like basically, I'm trying to say is thank you for the motivation. I feel it's dope. You know, but that's another thing too. I have too much anxiety. I focus on things that have nothing. Like see, I like that do with anything. Like I just alienated. That's not even a word either. I was just good here, and then I go, fuck, I gotta talk to him, and I zone the fuck out, and it probably made you feel weird. You know what I mean? Like we both felt weird there. This is the same way when like every time like I do that with girls. Like if we're both naked and I say dumb shit that just like ruins everything. Like I remember how like the girl was on top of me and I go, is that your air conditioner? Like I don't know why I said that. She goes, what the fuck? I go, there's a noise. Like I was just so bothered with the noise. That's why I don't watch porn, because I get too caught up in the shit behind the porn. Like to masturbate, I don't even use porn because I get mad at like, why is that guy's sock like that? Like you ever watch, because there was one guy, like his sock was high up and the other one was crunched, and it bothered me. I was like, get the fucking, then I start yelling at the laptop, I'm like, get the sock up! And then there was the lamp in the room. You know when you go to a hotel and they move the lamp? Like you know it was moved and they didn't move it back? I shut down the porn because of that and I just closed my laptop. So now I masturbate with my imagination, which is crazy. Like that's how, like nothing, like no lube, just raw, just imagination. I have 5 stories. Isn't that insane? 5 stories that I go to with dialogue, a producer, a director. Like it's just a whole like. And if it's not done right, I get soft. I don't know how to explain it. Like I'm like, okay, this cast isn't doing it, and like I get soft. Here's one story. This is one of the stories I masturbate to. I go into the bank. It's the afternoon, and it's like the time when the bank gives out donuts, like one of those kind of, and coffee. Like you have to just donate. That's already, it's lit already. I'm like, this is dope. And then there's the teller who's an older white lady, like, she's blonde hair, blue eyes, and like she's wearing a white top with like a black bra, but she unbuttoned a bit, so you can kind of see her boob like a bit, but she knows that, but she does, like, she wants you to see it, but not to approach. Like, she's luring you in. Like, she's like, it's almost summer, and it's not summer yet. It's like April, but she's letting you know that it's about to go down in the summer, and I have a check. So she goes, she's like, well, how can I help you? And I'm like, oh, I'm here to cash my check. I slide my check. She looks at me, she goes, that's all? And then I fuck her. Like, I don't know why. Like, this is ill. And then the bank manager comes out, and then he goes, not on my watch! But I'm wearing his watch. It's ill as shit. Thank you very much. My name is Dave Merheje. You guys know.
Thank you. I should clarify that this is a discussion on healthcare, sex fantasies, and Ja Rule. Inclusive. So, it's fun. All right, your last comic for the evening is an extremely funny guy. He's got an upcoming HBO special. You may have seen him on Ellen recently. Give it up for Quincy Jones.
Thank you for clapping almost till I get all the way to the mic. That's so humbling. I want you guys to know that. That is humbling. About as humbling as when I realized that when I first learned the difference between HMO and PPO. You guys know what I'm talking about? Okay, if you guys don't know my story, I have cancer, right? And I look great, thank you. But keep going. So I have cancer, and last year I had booked a tour of the East Coast for 3 months. I was going to go on the East Coast to the summer for 3 months, and I had it all lined up. I was going to make at least $3,000 for 3 months. Like, I don't like to brag, but money was going to be coming in. Super excited. So I go to Boston. Let me stop. I've been having stomach troubles for 6 months, right? And I did what anybody else would do. I went on WebMD. And I Googled all the symptoms. My belly's filled with fluid, ascites, and I diagnosed myself, and I came up with celiac disease. And I was so relieved to find out it was cancer. I'm not going to lie. It was such a breath of fresh air, because I can eat regular bread again. Do you realize that? Like, that's more important to me than anything else. I don't think you guys get how hard it is to ask for gluten-free items looking the way I look. You realize that? Like, I have to ask for like it's a drug deal going down. Like, hey, player, come here, man. Listen up, man. Listen, hey. Listen, man. Do you have any gluten-free pasta in the back, man? I'm sorry, sir. Did you say gluten-free pasta? Yo, shut the fuck up, dog. What the fuck is wrong with you, man? Fuck is you about to get us all pinched? I'm on a date, man. What the fuck is wrong with you, man? Fuck out of here. So I go to the East Coast, and I go to Boston, and it ended up being like a tour of hospitals, basically, because I went to Boston, I went to the ER there. They drained my stomach. It came out red. I was like, you guys fucked up. They're like, no, we do this all the time. I'm like, no, I do this all the time. You did not do this right. I know that for a fact. So then I got out of Boston. I went to New York. I went to the ER there. I was in the ER there for like a week. And then they let me go. I forced myself out, and then I went to Jersey, and I was in there for like a week. And then they're like, yo, we called LA County the results of your biopsy that you took. It's cancer. I was like, dope. What type of cancer? They're like, mesothelioma. I was like, hold on. Asbestos. I've never done a day of hard work in my life. How the fuck did I get this? How did I get this cancer? This is weird. Like, we don't know, man. I'm like, so what do I do now? They're like, you gotta go home. I was like, all right. I thought there'd be something different, but I leave Jersey. I come back to LA, and I first of all had to Google what a cancer doctor is called. It's not called a cancer doctor. It's called an oncologist. So I Googled oncologist. I was like, best oncologist in LA County. And I called him. I was like, yo, I got cancer. I need to see you. He's like, all right, do you have an HMO or PPO? I was like, I have cancer. I need to see you. He's like, no, HMO or PPO. I was like, I have never heard these letters presented in my life. I don't know what you mean. They're like, well, HMO means. I was like, so the HMO means I have more freedom? to go wherever I want? They're like, yeah. I was like, I definitely don't have that one. I know for a fact I have the poor people option. That's what PPO stands for. So so basically I had to go to a doctor. I had to go to a doctor out here in LA I told him, I was like, yo, I got cancer. And a doctor, when you talk to a doctor, they don't even like listen to you. They're like, hey, I hate to break it to you, Mr. Jones, but you have cancer. I was like, that's what I just told you. I just told you I had cancer. I know what I have. Do you know what I have? I don't need to read the chart. Let me see an oncologist. They're like, all right, yeah, well, we're going to go ahead and put you on a list. It's about 8 weeks. I was like, for what? Till I'm cured? Like, what do you mean, like 8 weeks for what? They're like, no, it's 8 weeks to see an oncologist. It's like, you can't tell someone they have cancer and then tell them to just chill. Like, that doesn't work. Like, you can't cancer and chill. You know what I'm saying? Like, you can't do that at all. It's just impossible. So I was like, fuck that. I went to the ER. I went to LA County, and I, forced myself to get him in. I went in there one morning, and, LA County is exactly what you think LA County's like. I don't know how to explain it any more clear. It's like the worst. It's the worst place with people that mean well, but don't know what they're doing. Does that make sense? So I go to the ER. I was like, yo, I have cancer. I have ascites. I haven't had treatment. Please admit me. They're like, okay. So I fill out the paperwork. And 14 hours later, I get a hospital room in the ER. And then 6 hours later, I get upstairs in my own room. And that started a stay of 45 days. I was in the hospital for 45 days. I got out on the 45th day. I did 2 open mics because I'm a real comic. And I do those 2 mics. And then I still didn't feel well. And then I went to a rich Jewish people hospital. And I have to make that specifically known because Jews get the best healthcare treatment. That's a fact. And, so I went to the good one, and they're like, "Hey, you had a heart attack." I was like, "That's impossible because I've been in the hospital for 45 days prior to these 2 hours that I've been out." They're like, "No, you had you have a blood clot the size of a 50-cent piece in the bottom aorta of your heart." I was like, "All right, what do we do?" They're like, "Well, we're going to put you on blood thinners." I was like, "Dope, let's do the blood thinning." And they're like, "Well, we can't." I'm like, "So then don't say I have an option of doing things when I really don't have an option. Just tell me everything bad up front." They're like, "Well, we can't give you blood thinners because you're on chemo." And I was like, "Well, let's stop chemo so I don't die of a heart attack. I'd rather die of cancer. Like, that's the option I have." And they're like, no. We're going to call your oncologist. Do you know his name? I was like, of course I don't know his name. He's in LA County. Those people, it's like fucking 3-card money. Like, I don't know who the fuck. Like, that shit is the fucking worst. So, I went through that. And long story short, I've racked up a lot of hospital debt. But the good news about having cancer is I have no intention of paying anything back at all. I have no intention. It's a good thing I got that Ellen money under my stage name, because if an oncologist is watching Ellen, then what the fuck is he really doing? You know what I'm saying? Like, I don't think he should be doing some other shit. Was that, what minute light was that, Toby?
1 minute.
1 minute? Okay. So, I mean, we talked about healthcare. Right? We all, like, healthcare sucks. Right? We all know that. It's weird. Like, I don't get, like, did you guys see $1 Million, what was the movie, the Matthew McConaughey, what was that? Dallas Buyers Club, $1 Million. You know what I'm talking about. Dallas Buyers Club, right? Right? You saw it? And I started crying. Like, because chemo fucked me up emotionally. Like, I am a baby. I'm needy. I'm clingy. I get what it's like to be a 13-year-old schoolgirl now. I get that now because I cry over everything. And I was watching that movie and I'm bawling. I'm like, oh my God, this is so. And then I got to thinking, there has to be a better way to fight cancer besides chemotherapy, right? Do you guys ever feel like that? You ever feel like they're like, no? All right, well, I don't want to get too deep. But, I mean, 9/11 was an inside job. And what if that was my closer? 9/11 was an inside job. SARS was fake. And I know where those planes from Malaysia are. That is... thank you guys so much, man. Thank you.
Quincy Jones, everybody. Fantastic. We're going to keep the clock going. We're going to bring our other comedians and our special guests up to the stage. Welcoming back to the stage, Dave Merheje, everybody.
Yeah.
And of course, Quincy Jones, you made him walk all the way to the back. Now you got to walk all the way to the front again. We also have a doctor in the house, Dr. Daniel Bruggers, everybody. He's a former U.S. Navy flight surgeon.
That's good. This is the doctor?
This is the doctor.
It's fucking model, man. It's not
You gotta stand.
yeah, you gotta show respect for it.
I didn't know. Are we standing?
Everybody's standing around. For everyone listening to the podcast, everyone's standing on the stage for no reason whatsoever. But we are, I guess we are standing for our next guest. He's the host of KCRW's Left, Right, and Center, Mr. Josh Barro, everybody.
I feel like we're all about to sing the national anthem.
Or we're going to mourn Prince the way he should be mourned. There we go. We have fair enough. Two girls who know about the purple.
Cool. So we usually start things off by giving our experts a chance to respond to any of the stand-up. If there's anything that struck you, anything you want to fact check, anything you know about Ja Rule, just...
Oh, like I have to do the back check?
No, with Josh, if you want to.
I'm pretty sure you can't rap underwater. Yeah, I mean, I just the thing that strikes me and the thing that I think has been really central in our political debate around this is basically that the United States, when you look at it compared to other rich countries, we spend about twice as much money per person as the average spending on healthcare, and to achieve roughly similar healthcare outcomes, and yet a substantial portion of the population, still about 10%, even after the Affordable Care Act, isn't covered at all. And the first question is isn't that really stupid? And shouldn't we just do what other countries do? Isn't what they do better? And I think the answer to that is yes, what they do is much better, and there are excellent reasons why we can't do it. And I think we saw that in the fight over the Affordable Care Act, which is basically, even amidst all of these things that are identifiably stupid, most Americans are basically happy with the coverage they have now, and they freak the fuck out if you try to change it. And Americans have also developed this expectation that the way healthcare should work is sort of that, I should be able to pick more or less whatever doctor I want and be seen in a timely fashion, and I should be able to get whatever care I deem is the useful and appropriate thing for me to get, and then somebody else should pay for most or all of it. And not everyone has coverage like that. You obviously don't have coverage like that if you're in Medi-Cal, but
but it is free, so it's pretty.
But
free.
So there's that advantage. Yeah. But really, a lot of Americans do have that coverage. I would say Medicare meets that standard. Most employer-private provided insurance meets that standard, and any care that's structured like that is going to be really expensive if basically you allow the patient and the doctor to sit in the room and decide what to do and send the bill to somebody else. And the way it works in other countries is you have a government entity or a government-financed entity that sits up there and crunches the numbers and says, this isn't cost-effective, you can't have it. And that works fine because Americans consume a lot of healthcare that doesn't do a lot to improve their health or extend their life. And if we didn't do that, we'd save a lot of money, and people wouldn't have substantially different health outcomes. But people would be really upset because people think irrationally about their health care, and they really, when they're faced with the decision with their doctor and they can sit together and say, should we spend money on this, they gravitate toward an answer of yes.
Well, I mean, I have decorated my house with just all of my MRIs, just the whole gallery, and for me, it's worth it.
Yeah. Yeah. No, I mean, I needed an MRI, and my doctor convinced me to go to the expensive MRI place instead of the cheap MRI place. And she was like, "Oh, it's really better. The quality of the imaging is better." And then it came back, and she misdiagnosed what was wrong with my shoulder. And then I got to the physical therapist, and he like touches me in this one spot on my shoulder, and I scream, and he's like, "You don't have a torn labrum. You just have tendonitis." And then I had I didn't need the surgery the doctor had incorrectly told me I needed, and 10 physical therapy sessions, the swelling in my shoulder had gone down, and all of this expenditure had been turned out to have been worthless. And I had no good way of knowing that, and my doctor's incentive was just to send me for the MRI at the imaging place affiliated with the hospital that she worked at. So the system's full of terrible incentives. But if you instead had this bureaucratic entity that was saying, no, go to physical therapy first, don't get the surgery, people would be upset. They would say, what, I need labrum surgery. Why are you telling me I can't have this surgery on my shoulder?
All right, Daniel?
Okay, so a lot to address. I'm kind of like a mosquito at a nudist beach, lots of options. And, so part of the problem with discussing healthcare and the health system is it's a complex system. There's a lot of things wrong with it. And a lot of times what's actually wrong gets obscured. So there's a tendency to also view, if we want to use the medical analogy, things that are symptoms instead of the disease. So, if someone comes in with a fever, the fever isn't the disease. The fever is the natural response to whatever's causing it. But when it comes to healthcare, the actual root causes have been so obscured for so long that most of the American public has almost lost the imagination to be able to conceive what the root problem is. And so, as far as it being cheaper in other places and better, I would say qualitatively, iffy.
The pipes in this building do not agree with what you're
saying. That you were worried about.
It's a good callback.
Whenever people say that, usually what they're looking at is the lower cost per capita, which is true, it's lower. But what they also don't look at is and then they tend to look at two factors, which are life expectancy and infant mortality, which are not really great metrics because one, infant mortality is decided by each country. So, for example, the U.S. has a higher infant mortality.
I was just thinking of Spartans right there. Just Sparta, fuck it. A weak child, throw him to the fire.
Exactly. So they're bad statistics. So, for example, in the U.S., if a child is born prematurely at 24 weeks and dies, we count that as infant mortality. You go to Cuba, which is often lauded for how great it is. There the kid could be alive for 2 weeks and dies. It's stillborn. So, they're using
those Cubans. So wacky.
Are a little misleading, but you're right. The U.S. is way too expensive for what it should be. But I would argue that the root cause behind it all is you have to look at, why do we have this system? And so I think a good analogy for health insurance as it operates in the U.S. is, let's use auto insurance as an analogy. Now, your auto insurance is meant to pool risk and hedge against uncertain expenditures. You don't count on it to fill your tank, to wash your car, to detail it, to change your tires, etc., and so on. And so imagine now if your auto insurance covered all those things. Anything you want to do with your car, you wanted to put a new stereo, your auto insurance covered it. Now let's take it a step further and say your auto insurance is now paid for most people by your employer. So you actually no longer even see this cost. And you don't realize that it's just coming out of wages at the end of the day. So now you have this situation where you're totally blinded to the cost. You don't perceive that really all it's doing is reducing your wages, and it covers everything. So now you have an extra incentive to consume more and more services. Furthermore, because the providers of those services know that you don't pay for it directly and are blinded to the majority of those costs, they really don't have to compete on price anymore either. They can start jacking prices up, and you don't care. Just like when you go to the hospital, it's well, I don't know what it costs.
And you're still driving like a piece of shit Sentra.
Exactly. And so it starts to drive up there's no longer competitive pressures on the provider side. People consume more, which drives up premiums, which are further hidden from the consumer, which further decreases wages. A lot of the stagnant middle class, if you actually factor in the increased cost of employer-provided health insurance, is not as stagnant as you think. But so anyhow, there's a lot to go on here. But I think, it's easy to come up with easy answers oh, it's the greed of the pharmaceutical companies. It's the greed of whoever. But the reality is you have to look at what the incentives are and how they got there. And the whole employer-provided health insurance is a bizarre outgrowth of World War II, basically fixing wages and compensation.
I knew the Nazis were behind that.
They are. So anyhow, like just like you wouldn't think your employers would provide auto insurance, you purchase it, you shop around, you get a better deal. Like health insurance was once like that until basically the government got involved, and everything else that has like taken us down this road, by and large, it's the government fixing the previous problem they created, and it's happened so many times now that the root causes that have like removed a competitive market are now no longer visible to most of the population.
I just want to remind the audience, we do a lot of Q&A during the show, so we're going to actually bring this microphone down over here. So if at any point you have questions, just please come up, and we'll call on you, and you can ask them. So
Yeah. And I also just wanted to remind you that you will be tested on everything here. So make sure to take good notes. Okay, so all right, so I think the first question, I guess we've covered a little bit, which is like what's right and wrong with our healthcare system. But there have been a lot of solutions recently advanced to propose it. I mean, I think the big one is Obamacare.
Affordable Care Act.
Affordable Care Act, if you're wondering.
Right.
What's your opinion on how that is done for the healthcare marketplace overall?
I think it's been a marginal improvement to the way healthcare works in the U.S. I see two main areas of improvement. One is that it's improved incentives for medical providers, basically changing the way they get paid, trying to shift away from a system where you pay doctors and hospitals for every service they provide and create an incentive for them to run as many tests and take as many appointments as possible, where they're instead paid either based on how many people they treat or on what outcomes they produce for those people. So in theory, they're paying the doctor to make you healthy, and if the doctor can find a preventive way to do that that's cheap, they collect the same amount of money and spend less. And it's supposed to discourage wasteful care. And they're still working out these systems. It's very complicated because you don't want problems where people try to get patients and then not treat them at all and let them fester and get sick and die. And you don't want people to go out and just like get all the healthy 27-year-olds in their hospital and say, look how cheap it is to keep all these people healthy. But there seem to be some promising results from that. Healthcare costs have actually been going up pretty slowly over the last few years. We still don't know how much of that is the Affordable Care Act, how much of it is just that the economy is slow and prices for everything are going up slowly. But that looks promising. And then it's also, you talk about how we have this weird system of subsidies put together to provide insurance, and we use the fact that there's no tax on health insurance provided by employers to subsidize it. I think this made the system of subsidies a little more sensible. It basically took some money away from rich people in the form of higher taxes, and it took some money away from old people in the form of cuts to the Medicare program, and it poured that into subsidies for lower income people to make insurance more affordable and increase the amount of coverage. And I think that's been, that's a fairer distribution of those subsidies. I think there are two big problems with the law. One is that people really don't seem to like the plans very much. And that's for a couple of reasons. One is that they tend to not include a lot of really good doctors, and they tend to have very high deductibles. The funny thing is the high deductibles are something that people on the right have been pushing for a long time, that people should have plans like you described that are really insurance, and you should pay for routine care.
Note one thing with that ideally with catastrophic, yes, it would be a high deductible, but your premiums would be lower. But this is the worst of both worlds, because what you have is a very high deductible, but also relatively high premiums, because they're basically forcing you to cross the subsidized other cohorts because you can no longer do an actuarially fair premium structure.
Well, no, but that's the thing. The way it worked before is that you could get, if you were a young healthy person, you could get a catastrophic health plan with a low premium because you were probably not going to get hit by a bus. But the thing was, if you had a pre-existing condition, then you just couldn't get a health plan at all.
I was actually denied because I had tennis elbow. I couldn't get health care for a while.
Yeah, and so this is
all those years, man, sacrificing on the court for us.
And the way this was theoretically dealt with was that if you already had health insurance, then you couldn't be denied on the grounds of having a pre-existing condition. The problem was that you had to continuously have health insurance all the time, and for a lot of people who were in and out of work, that simply wasn't affordable to maintain continuous coverage like that. In practice, it does not seem to be effective to tell people you won't be penalized for having a pre-existing condition so long as you pay a health insurance premium every month. So the cross-subsidy really, it's not, I don't view that as creating a problem. I view it as admitting that there was a problem all along, that people who really needed the health insurance most couldn't get it under the old system. The high premiums are a reflection of the fact that healthcare is extremely expensive in the U.S. and that most of the cost of care is to provide care to the relatively relatively small number of people who have chronic conditions who really consume a lot of healthcare. And those people, by the way, you won't get cost reduction for them by having high deductibles, because if you have, if you're on dialysis or you have some other chronic, you take HIV medication, you have a chronic condition that costs thousands of dollars every year, you're going to blow through even a high deductible. You need ways to achieve cost control for those people as well, because that's where most of the spending is. So
Quincy,
I think,
Quincy, what's your experience been like with after your diagnosis? Is that considered a pre-existing condition? Did you have? You say you didn't have insurance beforehand.
I mean, I think most Americans, like, when you're in pain, you just want the pain to stop, and you're pretty much willing to do whatever it takes. And then you know, obviously the number one option is to go to a doctor, and that's usually your first, baptism by fire into the healthcare system, because most of the times people are healthy. I was a healthy dude before, and then I found I had this cancer. We still don't know where I got the cancer from. So when I went, and all of a sudden I had to go through a lot of doctors. I had to go through, I was in the ER at least 25 times last year getting my stomach drained. So when we're talking about healthcare, you're talking about the nuts and bolts. I'm talking about the actuality of it with the people. And it's like, and you guys are great. You guys have a lot of information on it, but in reality, it's like people want to stop the pain, and people want to live longer. Now, there are some people out there who aren't willing to do what it takes, the extra steps to live longer, right? So if there's a lot of overweight people and they get diagnosed with diabetes, they're like, well, give me a magic pill to make me lose weight. It's like, no, how about you start eating healthier? You know what I'm saying? Those are
But
steps
make that magic
take.
pill delicious.
Yeah, that's it too. I need Kool-Aid flavored medicine. That's in my contract. But seriously, it's like, so when I hear what you guys are talking about, like the healthcare system, and then like, if you really want to talk about the sweeping arc of it, it's like, okay, well, the FDA greenlights everything, so our food is fucked. Then if you really want to talk about it on a sociological aspect, okay, let's talk about how poor people don't have the same options as more affluent people. There's no Whole Foods in the East Side. There's only Whole Foods where rich people live. You know what I'm saying? Unless you count downtown LA, and that's recent. Okay, so don't be that well actually person. Okay, so relax, audience. I felt someone out there like, well, yeah, but I fit them. But so it's like the food, so it's a whole bunch of like major missteps of stuff like that. And then it reaches your average person who's like, I'm sick. I don't know if it was tennis elbows a real thing or whatever, but I don't know.
Yeah, check out Toby trying to compete with the guy with cancer.
Oh man, Toby's trying to steal my credit, man. Please don't steal my cancer credit.
Me and Sampras. Oh boy, Sampras and I.
But money talks. Money talks with the help. I mean, if you have money, you'll have more options. Like you said that the doctor said, you need a surgery, your labrum's torn, and it was like, no, you have tendonitis. But you had the money to get a second opinion. Most people don't have the money to get a second opinion. They have to take what these doctors say for gospel. If I listen to what my doctor said or the oncologist said, hey, you have a year to live, and I believe that, then I probably would be in a worse situation than I am now. But I didn't believe that because I don't really feel like, what? A year? Nah, let's just do whatever it takes. You know what I'm saying? And that was my mentality. That goes to different mental conditioning and emotional upbringing and all that stuff. But when I hear what you guys are saying, it's like, man, no one president, like everyone thinks that like success in America is deemed by like terms of the presidency, when each president is dealing with what the last president did in the last term. So
and also there's sort of this idea, and I've experienced myself when like changing health insurance and stuff like that, where you think that when you go to see a doctor, that doctor knows his shit. Like, that's going to be a good doctor because you don't put a DR before someone's name unless they're really good, right?
Or Dr. Seuss.
Yeah, or exactly. I wish. But that was a little weird. Like, everybody, the dude kept buttering his toast on the opposite way. I was like, all right, this guy's fucked up. But it took me a long time. Like, I recently had a thing with you don't know what I'm going through, dude. I had my turbinates in my nose. I couldn't breathe for shit, and then I went to an ENT, and finally I found like an ENT in Marina Del Rey, who was amazing. He was great. Exactly. I don't live in Marina Del Rey. I had to drive there to get.
You got a car and you went in Marina Del Rey. What is it, the 1% show? Is that what I signed up for? Don't flaunt your cash to your panel, okay, Lil? You changed since you got commercial money. You changed.
Lou, I think it's kind of dope.
Thanks. If I was Ja Rule, me and Ja Rule are gonna come. We're just gonna rap about our ENT doctors in Marina Del Rey. No, but this is the first time where I had seen a number of doctors before, and this is the first time I was with a doctor who actually took his time and explained to me and went through everything and made me feel like a human being and was going through all the options. And I was thinking like, man, there's just millions of people who don't have that experience with someone who cares and knows what they're doing and is going to actually help.
Well,
a
specialist is what you went to,
right.
like as opposed to going to a doctor.
Right.
Like for a mesothelioma specialist of the peritoneal, there's only like 5 in the country, and most of them are in Baltimore. That includes airfare. That includes out-of-state Medicare. So there's a bunch of other things. But most people don't have that option of seeing a specialist. So then you have to see a specialist. And then a lot of times Americans don't know what the average trip to the hospital costs to see a doctor, to see, to get medicine or whatnot. Or, God forbid, you have to ride an ambulance, right? We all know it's expensive, but it's like, then you get the bill, you're like, Jesus, what? It was 4 blocks. It was 4 blocks to go to ER in New York, and that cost me $2,200. But a lot of people don't realize that. So
a limo.
Yeah, pretty much. I might as well Uber. You know what I'm saying?
I don't have health care.
But you're Canadian.
Yeah, I know.
Aren't you just
Still,
born with healthcare?
No, I don't have. Yeah, I was actually, but I don't have American health care, so it's probably scary. I don't even know. I can't relate to any of this.
What's your?
I'm just saying I've never seen a doctor.
Why are you here?
I don't know. To be honest, people ask me to play basketball here, and I'm like, I'm not playing basketball. I don't have health care yet, so I've not done any active shit. Because I just don't know what to do. I don't even know where to go.
I mean, you could just fly back to Canada, right? If you like.
Wait, did you not realize we're comics? We're not all doctor fucking professionals over here, okay? To fly back home? What?
Well, but then it's free once you get there, right? It's
yeah, I could walk in and check up.
Well, you pay for it on the way, so it's rationed by time and access. So
he's gonna say it better.
There's a reason why when wealthy people in Canada or Europe or prominent politicians in those places that have such wonderful socialized systems, when they get something bad, a lot of them come to the U.S. because we do have better care for the more difficult and complex stuff. Now, I agree, the system's incredibly overpriced, but it's important when you discuss this to be realistic as well. Like this side of heaven, there is no utopia. There is no one magic law that will make everything great. Scarcity is basically the first rule of economics. The first rule of politics is ignore the first law of economics and pretend that there's unlimited resources. And so, when you craft a policy, you want to craft something that gives the best access to the most people and will improve quality and lower costs. And then it's worthwhile. I'm all for having a safety net to cover people below a certain level. So if you don't have the means to pay, there should be a basic safety net. But what happens is we basically kind of want that safety net to start creeping up and up, and eventually the part of why costs are so high and distorted, again, it's because government gets involved, but we don't really see it for what it is. So take cell phones or smartphones.
Do you want to do a selfie? Can we do a selfie right now?
So take cell phones, for example. What a miracle competitive markets actually are. And it works for almost everything where there's an actual competitive market. So if you go to the CEO of General Electric and low-income Americans, in fact, probably both of them will have the exact same iPhone in their pocket. And both parties are actually pleased with what they have. And this didn't come by central planning, some, uber-mentioned government organizing these things. These things happen because competitive markets over time drive things down. And innovation is what actually makes things better over time by leaps and bounds. And that's one of the areas where we don't have innovation in the form it's delivered, in the way it's structured, in the way records work. And so we really need to kind of get back to a competitive market and maintain a safety net to help those who need it.
But no country has ever had a modern healthcare system based around a competitive free market. There is no model. There is no model for this anywhere in the world.
I disagree with that.
Where would you say?
Shit.
So it depends on what you're going to say. So the usual thing people say when they're coming from the left is there's no perfect free market. And yes, there is no perfect free market. Again, utopian perfection is not this side of heaven. So what you have to look at is actually what I would say developing countries that are economically on the ascent, where there is some form of socialized healthcare that covers a basic net, but then there's also a very vibrant and active competitive market. We see this in a lot of Latin America and other places. And what you actually see there is like, so I grew up in Peru till I was 18. And my brother...
Nobody saw that happen. Nobody saw that.
When the fuck was he gonna drop that? Look at this fucking Nordic god over here. All of a sudden he grew up in Peru. Listen, Thor, no one's believing that, okay?
I actually think that you're actually composed of like 3 Peruvians stacked up on each other. I was wearing like great skin.
Just don't want to be the one in the middle. But it's like, my brother got LASIK eye surgery done in Peru when in the U.S. it was still costing, almost close to like $2,000 per eye. He had it done. This was quite a long time ago, but he had it done at that same time for I think it was like about $400 an eye, and he's had 20/20 vision ever since. And so, where you have kind of a robust competitive market without kind of these distorted price structure. Now, LASIK actually is one of the few things that's getting better in the U.S. because it actually is a free market. But again, like, there is no perfect free market, but if you look at areas where there is the most kind of parallel, there is some kind of socialized thing, some safety net, but there's a vibrant free market, things do better. And even in healthcare in the U.S., wherever you have an actual free market, costs go down.
I would just caution against radical experimentation in the structure of the healthcare economy. Again, we've seen how much it freaks people out when you change things a lot in this. And when you look at models, you try to look around. I wouldn't look to developing countries if we're trying to come up with the best model for healthcare, because there seem to be a lot of advanced countries in the world that have excellent health outcomes where people seem broadly happy with healthcare systems, including Canada, from which there are. Sometimes people want orthopedic surgery and there's an 8-month wait list in Canada and they want to come down here and do it, and they can because they're rich, but that's not typical experience there. In general, around the advanced world, people report satisfaction with this system in their countries. We already have all of these countries out there that have these systems that are performing better on any reasonable set of metrics than the United States system.
Okay,
whereas
because I'm not going to let you get away with that as if it's like
spending approximately half as much money for similar life and health quality outcomes.
Better outcomes.
People live longer, I guess. That'd be the...
Yeah.
Basically, all you're doing is you're reducing all of the human experience to dying, like in your first year of life, and total life expectancy. Which, first of all, those aren't even accurate metrics. And if you're gonna, don't even bring up the World Health Organization, because that's like the most bogus metric of them all.
But if
we have quite a few people from WHO here tonight. They're rather upset.
If we're paying double, I'd like a clear demonstration of what we're getting for that.
So let me just get you on the record here. So a single payer system would bring this down.
Hold on. Wait.
I just got to say that there is no record here.
Hey, we're a podcast.
Oh shit! What? My parents are going to see this?
Because if you're arguing for a single payer system, which is what you're
I'm not necessarily arguing for a single payer system. Not all the European systems are single payer.
All right, can I... Oh, excuse me. Does anybody know what the fuck these guys are talking about? 4 or 5? Okay, good. Someone explain it to me afterwards.
I just want to say you explained what I was going to say way better. I was just going to say I just pay for like the medicine, but then you get... I feel I get arrogant because I have like the health care. And I remember one time I forgot my card, and the lady goes, "You got to pay $80." I go, "I'm not about that life." I was like, "Oh man, I'm drunk with power." That's why I don't understand what's happening. I don't like it. I don't want to get on board. So why can't you give me a card? And I just go in. And
Toby, you shared with me an article. I know it was from The Guardian. I believe the writer was Lemieux, his last name. And I guess the basic argument there was that a lot of times when it comes to Europe, it isn't necessarily a single payer, but there is kind of this idea of a universal coverage where you do have a mixture of sort of government funded healthcare as well as private, kind of coming together. So I believe that the crux of the argument was kind of like Bernie's coming at it from a weird angle, Hillary's coming at it from a weird angle, where you don't necessarily need single payer in order to have universal coverage.
I think the main part is like we're sitting here talking about how much the healthcare system, how much it costs, but we still spend hella more money on the defense. We spend hella more money in the military system when our money could actually be applied to the healthcare system. But America doesn't believe in that. My personal, conspiracy theory is that America really doesn't care about the people. It just really, because so many people want to come to America, it's almost like,
refills?
Whatever. I really do feel like it is refills, because honestly, I have a rare form of cancer and I don't have health insurance. So what would I do? Where would I go to? I can't just go to regular oncologist. I have to see specialists. So where would I go if I don't have health care? So what am I supposed to do? Oh, well, the week, Paris? Or what would be your guys'
What has your experience been like, sort of like navigating that? I had a professor in when I went to school. He had brain cancer and he didn't have health insurance. And I can't even, I can't imagine what he or you are going through. Like, how do you navigate that? How do you
If you're trying to fight for your life and these motherfuckers are telling you to fill out this paperwork and then take it down the hallway, and you're like, yo, can I get some treatment first before, can we deal with the paperwork when I have the energy to walk down the hallway? Because right now I have cancer and I'm trying to fight that. Oh, I need chemo, so chemo's the only way possible? I mean, the system's fucked up. If you guys don't think the system's fucked up, I really don't know what country you guys are living in. Because the system's fucked up. We can all agree on that, right?
Yeah.
Okay. So
the cause.
Why it's fucked up? I mean, it's pretty obvious. It's the government, all the trickle down effect. I'm confused. What exactly were you guys arguing about why the system's fucked up? You want one specific reason? There's no one specific reason for why the healthcare system is fucked up.
There's a dude named Carl.
Yeah. And he wants a stapler?
Carl was walking with a bunch of papers and then he tripped.
Just fucked it all up.
They can't see that great act out on the podcast, though, man. Jesus. That was a beautiful act out, listeners, but you weren't here live, so you missed out.
Well, I think what Quincy's saying is, to me, it seems like one of the reasons why a free market-based approach would be limited, which is that, in the essence, you don't have health insurance, but you're still able to get health care because you can go to an emergency room and there's a Hippocratic oath, and people will treat you. So at the end of the day, I mean, if something costs so much, it sort of breaks it if you can just get it for free if you just go to any hospital and, don't give them the right information.
Thing here. So I think there's a lot of, unfortunately, demonization when we talk about free market and misunderstanding. So first of all, we have not had a free market in healthcare for basically over 60 years. Okay, so there is no free market here, and there's no free market that has failed. The government directly pays over half of all medical bills. This is even before the ACA or Obamacare. And then on top of that, the portion that's less than half that it doesn't pay directly is so controlled and morphed by all these regulations. So no one's talking about doing a radical change overnight and just saying, we're going, Mad Max style, devil may care. But we need to start moving more towards a more competitive market, so you get all the benefits of competitive pressures. Because a lot of times, all these debates are we're moving at 100 million from Medicaid here, there. I mean, it's just kind of like a hide the salami shell game, and it's tantamount to a bus going off.
What shell game is that?
That's a Peruvian shell game right there.
I think a few people in the audience actually got excited.
Oh boy! But it's like a lot of these debates are quibbling over, it's like if a bus goes off a cliff and you're quibbling over what radio station is on. Like we really need
KCRW.
Quincy is the system is totally messed up. It was messed up before the ACA, but the ACA didn't really do much to fix it. But the problem is we're so far removed from what we would help it best. And again, we want a safety net. We don't want to leave people out blowing in the wind. No one wants that. But the only way to really bring prices down, because again, it's unsustainable. It's an unsustainable path we're on, and to pretend otherwise, as if there's.
Well, I think a point of agreement between the two of you guys that you've been talking about is this idea of the third channel, the third payer.
Yeah, no,
that gets in the way.
The problem where you have two people in a room who decide what to do and they send the bill to somebody else tends to push costs up. And in theory, one way you could reduce costs is what you're saying, which is you make the people in the room pay. But there are two big problems with that. One is that often the patient doesn't have any money. And so it's not workable to just tell them, go pay for your cancer treatment. But then the other problem is we've seen with what happens when you give people health insurance plans with very high deductibles where they have to pay more, and they do in fact consume less health care, but the patients are not any good at figuring out which is the cost and effective health care, or they're responding more to the fact that they're cash constrained than to the fact that they now have financial agency over their health care. So they cut back as much on things that are useful and cost effective.
So what's your solution?
Well, there is another way to bring down costs, which is that you can have the government regulate costs downward. You can have the government...
Price control is like
that's what
a terrible...
That's what literally every other advanced country does.
Yeah, but that's why
it's like...
Oh my God, an applause break.
It's like...
Cost control? How does value?
Wait, use the...
Excuse me, sir. If you want to talk, you get on a microphone. None of this crazy Hollywood shit. You come in, you get on the record, sir.
Please do. Say, man.
But I think one of the questions is like how do cost controls what's the effect on supply?
Well, so I mean, for example, in the UK, there's this government board that like. They sit down with their green eye shade and they try to figure out how much a health treatment is going to cost and how much benefit it provides in increased life expectancy or quality of life or whatever. And they like put the value, they put a dollar value or I guess a pound value on a year of life. And if it's not cost effective enough, they don't approve it. And if the drug company won't sell them drug to them at a price that's low enough to meet that, then you can't get that drug in the UK. And it's why the UK has a very low health expenditure per capita. On the other hand, it means there are a variety of treatments you cannot get
it. Dropped out of the system, like he would be the first person to be dropped out. Under that system.
Well, we don't.
It wouldn't be cost effective.
We don't know that. It depends on the.
Actually, let's do the math. It definitely would be because it's rare enough that the cost effectiveness would not be there. So, like under the system you're advocating for, people like Quincy would be the first to be dropped, and then treatment for his rare cancer, not cost effective. Ditch it.
Not having seen your chart and not being a physician, I'm not going to opine to what the effectiveness of the available treatments are. But there are a lot of cancer treatments that get approved in the United States that have extremely marginal health benefits. The trial will find this drug extends life by 30 days or 60 days or something, and at a vast expense. But in addition to being expensive, these treatments often are very painful and put patients through a miserable experience that also provides very little in terms of life expectancy gain. And I think it's worth having a broader conversation about whether we want to put people through extremely painful medical treatments that provide low benefit. But part of the problem in the U.S. system is that there's a strong financial incentive to provide treatments like that, and then also people have, people want to feel like they tried everything, even though I think, it's obviously it's to the different patients have different views on this, but I think often people are put through miserable end-of-life experiences that were never going to provide significant health benefits to them.
I have a little bit of personal experience with that, where not myself, but
yeah, tennis elbow.
Yeah, it's lethal tennis elbow. But my grandmother was close to end of life, and she had a DNR, and she went into cardiac arrest, but they resuscitated her because she only had a DNR with the hospital and not with New York State, which is apparently required as well. So they ended up keeping her alive, with tubes and everything for 4 days at the cost of some tens of thousands of dollars, or you could probably measure that in teacher salaries if you wanted to. And then she died, and it was against her wishes. And I think it's an important part of the conversation is the end-of-life care, because it is so expensive. And, we sort of have a sort of a cultural stigma against talking about it, and you get, as soon as you start, you get people talking about death panels and things like that. So, yeah, I don't know. I just wanted to contribute that.
I mean, I feel like it's a little bit of everyone's fault for why the system is messed up. It's, the government's fault. It's the American people's fault. It's the doctor's fault. It's the pharmaceutical company's fault. Like, no one's trying to get screwed over. At the end of the day, pharmaceutical companies want to get their money, doctors want to get their money, government wants to make sure they get their share, and American people want to feel better without really having to do the work. You know what I'm saying? So it's not just any one thing per se, but I really do feel like it starts up top with the government, the FDA admitting all types of food that's not healthy for us. We consume the food. We don't do we're the most aren't we the overweight country?
Well, I don't know if the FDA has anything to do with food, right?
Well,
food and drug.
They do, but I don't think they have a lot to do with
first fucking food and drug. Oh man!
For a second, I thought I didn't know what I was talking about, but I realized I do. I don't think it was like. Did I mean FDA? Tell me, Franklin.
Toss me off this stage. Let me break my neck.
Oh, that was bad.
I don't think the Food and Drug Administration
Has anything
to do with food.
I don't think they have nothing to do with administration.
Erroneous on all accounts.
I agree with your. Is it a conspiracy theory you had?
I mean,
about people want to come because I came here and I don't know why I came here.
I mean, America has more opportunity. That's why people come here. I mean, America is banking on the rest of the world being fucked up for them to come here, but we are losing our foothold in being the advanced. Like we're not leading in anything really anymore. I don't know.
Feel your vibe.
That sounded like Trump for a second.
Yeah.
This is not for you.
And I'm here, 2020, Quincy Jones. I'm announcing it right now.
But I don't, maybe this is wrong to say, but like, maybe I don't know.
Don't say
I'm saying is like, I feel the vibe I get from America is that they don't give a fuck if you ain't, like, you know, like class system, like maybe in Canada they do, but it's just not as evident. Like when I live here, I'm like, holy shit, they don't give a shit about poor people. Like they just they don't give
Well,
a
I mean,
fuck.
LA is different. Like we have a whole
Granted,
road.
I would have to say that a lot of poor people don't give a shit about poor people.
Right? I think that sort of trickles up. I got to make up for that bullshit food and drug administration. Not having anything to do with food.
That's a good
Well,
balance.
no, because in my mind, I was like, they don't make sandwiches.
But I do think the thing here though is that like, you know, it's not the FDA's fault that Americans eat too many potato chips.
I think that's
like I don't.
But they do greenlight a lot of bad ingredients that go into potato chips. They do greenlight a lot of bad foods, and they can be bought. And they can be bought. Like that's evident. We all.
But that's not what makes people obese. What makes people obese is they consume too many calories. Like,
But the chips,
people love
But if there's
sugar
shitty
sodas.
ingredients in the food they're eating, so that doesn't have a play at all.
Soda full of cane
saying
sugar
that-
is going to make you fat too. Like,
said
it's-
what?
Soda full of cane sugar is going to make you just as fat as soda full of corn syrup. Like it's dietary. It's what it is that people eat too much. They eat too many junk calories.
Yeah, because we know America's known for moderation, right?
Right, and that's why like, you know, Mike Bloomberg tried to ban large sodas. It's like, and there's an interesting new study that came out from this economist at Stanford, Raj Chetty, that looked at differences in life expectancy across the country, and unsurprisingly, poor people live a lot shorter than rich people. And how big that gap is varies a lot from place to place. And so they can look at, you know, what are the places where poor people have higher life expectancies? Because rich people have similar life expectancies basically across the whole country. It's really poor people that vary a lot depending on where they live. And so they can look at, you know, New York and San Francisco, and I think it was Miami and a few other places. Low-income people do relatively well.
The rich eat the poor.
Did they really need a study from a guy in Stanford to determine that? That seems pretty common sense. But let me ask you a question.
Yeah.
Do you know what Tampico is?
No, what is Tampico?
It's that
All right,
orange
good.
drink.
You don't know what Tampico is?
No.
Does anybody know what Tampico in the audience is? Yeah? What is it? It's orange, just orange drink, right? It's bad for you, right? But chances are, if you know what Tampico is, then you grew up in a certain type of environment, right? But you don't know what Tampico is, and that is mass-produced in poor areas. Mass-produced. Tampico's only sold in 2 places.
So
It's only sold in one size. It's only sold in a gallon.
I feel like I'm about to hear like the way the CIA allowed crack to go into the ghetto. The FDA is allowing Tampico to go on Pico Boulevard.
Nah, what's up, man? You
We have a question from the audience.
Yeah, so I think I've had enough wine already, so that's why I'm able to speak.
That's the best opening statement of all tonight. I got enough wine, so I'm gonna tell some
This
truth,
isn't
okay?
karaoke. This screen will not have lyrics.
Purple Rain.
Yeah,
You
Purple
better
Rain.
hit it right.
We're all mourning, but
So I wish the free market system worked for lower income people, but it just doesn't. You use auto insurance as an example. The California Commission on Insurance had to step in because auto insurance people were deciding your rates by where you live, not how many accidents you had. And they said, this is crazy. Why should somebody in South Los Angeles pay more than somebody in Beverly Hills when there's more accidents happening in Beverly Hills? And I wish that I couldn't say that. I mean, I wish I could say that we need less government regulations. last week, I was on an American Airlines flight on Saturday. If I moved that flight from Saturday to Sunday, they would have charged me $200-300, okay? So what happened is that there was a mess up with their system, and it caused me to miss my connecting flight. So they said, we're going to fly you out on Sunday. I'm like, I have to be at work on Sunday. Nothing we can do. We're going to fly you out on Sunday. Did they give me anything? No. But if the government stepped in and regulated and said, hey, you know, you need to get this guy here by the certain point, or you need to pay him, I had to go and find my own flight from American Airlines because they said, we're flying you out at 7:30 a.m. There's a flight out of Dallas at 10 a.m. To get me to Dallas. And I had to do the legwork myself. And the thing is that it's the free market system always hurts poor people. I went to my doctor and I said, I want to go on PrEP, which is supposed to be 99.9% effective for preventing HIV. He said, absolutely not. And I was shocked to find out that that people of color are 50% less able to get PrEP than white people. And if things continue the way that they are now, gay black men in Los Angeles County, 1 in 2 are going to be infected with HIV. So I wish the free market system worked. I really wish I could believe in it. But at the end of the day, if the government doesn't step in, it's going to be the poor people that are really
I have a couple
hurt.
things to say. Number one, first thing I got to say is that gay black men are my favorite black men. Second thing, I think you have a great opportunity when it comes to the American Airlines thing. That's something that, I would say the free market actually, did, kind of give us, which is Twitter. And you can, start, some tweets, some hashtags. Everyone here, you're all involved now. You can tweet to American Airlines. We can, we could tag you on it and all that. Be like, take care of this man. You fucked him over. This is the last time. It happened to me with Virgin Airlines like 2 years ago. And I was just a young boy with a dream and some tweets, and they end up hooking it up. But that might be another sort of avenue to take.
Well, I mean, I think it's it's a bit. It kind of sucks if we're depending on people to go viral to get the right health insurance outcomes. I mean, I think that it does show one
High
of the
standards.
I think it does show one of the limitations of the free market, which is that it does serve high-income people very well. If you are in Canada and you have socialized medicine, but you want a very premium treatment, you can get the best treatment in the world in the United States.
That's crazy, though. That just
Yeah,
sounds insane.
but at the same time, there's just, there's often less money in treating stuff that, is disproportionately suffered by poor people because they're not going to be able to pay for it.
And also, you are dealing with, throughout this whole process, while you do have, government bureaucracy, which can kind of take a form, it kind of can seem like a chimera, kind of this monster. There are people involved. There are humans involved within the system, and the same thing happens when you're dealing with doctors as well. Where, for example, something that always comes up is this idea that everyone has a right to health care, a right to it. But what that entails is that means that you have a right to someone else's labor, And if you have a right to someone else's labor, meaning that they have no say in the matter, then that's slavery. I know it's a weird thing to say.
That's a pretty slippery slope.
No, it is a pretty slippery slope. No, but the idea when you can have government force or whatever force, gun to the head, you have to do this, or else you're arrested or anything like that. That's scary, and I don't think a lot of people think about that. But I guess what I'm just saying is there are human beings involved that have certain interests in the whole matter.
Wait.
You can stand up and get on the mic. That's it.
The government stealing, from a doctor, basically forced labor. I pay taxes. I pay taxes because I'm a citizen of this country. That's not the government stealing from me and my labor. It is, I'm part of this country. I want to participate in the rights and privileges of being an American
That's great.
citizen, so I pay my taxes.
That's great. You do it freely.
That's not being stolen. That's not free. No, it's not free. I have to do this or I go to jail. And that's not the government stealing from me or forcing me to do something. It is part of participating in this country.
But you just defined it. If you don't, then you go to jail, so it is force.
Yeah, but it's also, so what's my choice there?
No, hold on. We got to get that definition first. You popped up out of the seat very rude. You got to get the definition first. That is force. That is force. Government is force.
But it is also a choice that we as a society have decided is important and necessary for everybody in this country to actually pay their taxes so that we can have a functioning society. So if we make this decision that some things are going to be provided to us, and by the way, wait a second. The doctor who provides this service is being paid. It's not like they're being yanked out of bed in the morning, pulled away from breakfast, and told, go complete an open heart surgery on this guy, because they're getting paid to do this.
Right.
It's their job.
No.
So I'm still looking for the theft argument here.
Wait. For one, I didn't say it was theft. It was slavery.
It was slavery. My apologies.
Yeah. So the thing is, like, if I can make you, what do you do for a living, sir?
I write marketing copy.
Okay, I will probably never have to deal with you. Just because I probably never have to
except
do
for
it.
Right now.
All right, except for right. No, but if we were to have an exchange, I would want that exchange to be voluntary. I would want that to be, hey, you have a good or service that I want, and I need this service, and I'm starting to think like, hey, you know what, I'd be better off with your service. Isn't it great that we have a voluntary exchange? I would feel kind of bad if I offered you a service of being an open mic comedian, and then having somebody stick a gun to your head and say, you got to sit down and listen to an hour of this fucking guy. That would be really shitty. I think that would taint the relationship that we have. And all I'm saying is, I would love to see a system where guns aren't involved and people are voluntarily exchanging. Now, what you described right now between the doctor who's a heart surgeon and all that performing that, at this point, that's what he's doing voluntarily. That's all I was pointing out. Don't we want that? Don't we want them doing it voluntarily? There are no guns involved. There's no force involved on that. You moved it over to taxes.
There's no guns involved, but they're participating in a system like Medicare, where they have agreed to provide services.
If they have agreed to it, they have agreed to it. But there are a lot of, and something we can talk about, are the amount of doctors who eschew Medicare, Medicaid.
Listen, I understand you can have a two-track system where there is a single-payer option for everybody, and you can have an option for wealthier people who would choose to eschew that system. And
that was a real word. Come on, don't shit on my vocab choice.
I'm celebrating it. I'm enjoying it.
I celebrate you.
Find your favorite space of word.
This guy's sneaky. Lizzie got something to say.
On the mic. I don't know if he'll let you have it, but it's good.
They
will voluntarily relinquish that. We will eschew that microphone.
I think everyone's here is bad at analogies, though. I think all night long you guys have been making terrible analogies that make emotional responses.
The iPhone analogy sucks, by the way. We can talk about that later.
Yeah.
Hey, just because you have a Droid doesn't mean iPhone sucks.
Probably a flip phone. Well, let me just address one quick thing. So the problem with the free market, again, to quote Thomas Sowell, there are no solutions, there are only trade-offs. And so, yes, there is no perfect system, but actually if you look at countries where you have the freer markets, the poor tend to do best even in those countries. The problem is the rewards and the fruits of competitive markets are often not as visible, and they accrue over time. And so we kind of become blind to them, whereas a one-step government intervention, hey, I'm going to take $800 from you, give it to you, that's visible to all. But if you actually look, trust me, the poor in Venezuela aren't living large. The poor in a lot of countries that have a lot of government regulation.
And they do have a constitutional right in Venezuela to health care as well.
But they do. But they don't have toilet paper. They have a constitutional right to health care, but no toilet paper.
But this is all first principles arguments about markets, and you bring up Sowell. I went to enough libertarian seminars in Washington and got handed enough Sowell and Hayek books. But the problem is markets and different kinds of things are different. And the reason healthcare is different from an iPhone is that it's easy to pick up a smartphone and figure out how much it costs and how much value it generates for you and whether you like it or not. The problem with healthcare is that it's almost impossible to figure out what anything is going to cost. You go in, you try to ask a doctor.
Because of the way the system
but it's not because the government made the system like that. It's because you have a zillion different providers, and they send it out, and a lab does the lab work. Your doctor didn't know that was going to be an $850 lab bill. He never sees the lab bill. The lab decides how much they're going to charge for that. The lab negotiates separately with the insurance company, and then in addition to that, the difficulty of figuring out costs. The other thing is you can't figure out value. You don't know whether the advice that you're being given to from your doctor, what the benefit of this treatment is versus this treatment. You can't evaluate it like a phone. And so that's why when you give people health savings accounts, it doesn't cause them to become immensely informed consumers who make great decisions and save tons of money and drive down the cost of healthcare in America. People just make decisions blindly because they don't know how to evaluate it, and that's why it doesn't work like the market works in electronics.
Let me just address one thing, because again, he's proving the exact point I made at the very beginning, that there's so many layers of like intervention, problem, we intervene to solve this problem, that like they lack the imagination to even see, like, you're right now pointing to the fever and saying, the fever is the disease. No. Because you
are oversimplifying. You're treating this like you can make it like a small personal electronic device. It's not complicated because the government made it complicated. It's complicated because healthcare is inherently very complicated and difficult to evaluate.
No, listen.
And because there are immense distributions of costs. The other thing is that, some handful of people are going to be really expensive.
60 years of distortion. So, like, again, I agree it's complex, and I actually want to acknowledge that complexity. You're the one who basically points to the problem, which we both agree is a problem, but then your solution is what? Price controls?
My solution is to look at the available systems that countries use to deal with this and try to see how they work. And there's a reason that the thing you have described is not done anywhere.
Josh,
it's purely theoretical.
One example, and I'd love you guys to comment on it, and for anybody out here as well. I don't know if you guys saw it, but I think about like a year ago, there was this petition going around. There was a young couple in, I believe it was like Texas or some other, or one of those unimportant states, whose child was deaf and needed a hearing aid, right? And their insurance didn't cover the hearing aid, right? And the hearing aid cost $6,000, right? And this petition that went around were people signing it saying, this is ridiculous. The insurance company has to cover this hearing aid. It's so this is blatant. This is ridiculous. And for me, when I first saw it, I was touched by it too. I have a nephew who has a cochlear implant, and I know like how expensive that is. And I'm like, damn, I want this child to hear. But then I started thinking, like, the question that I had wasn't so much why isn't the insurance company covering this. My question was, why the fuck is it $6,000? Why is it that much money? Why is it that I have I have an iPhone that costs me under $1,000 and it's in my pocket and does all these amazing things. And I'm wondering, like, what is standing in the way of somebody making a $200 earpiece to help kids hear? What's standing in the way? Are we talking about patents? Are we talking about FDA approval? Are we talking about occupational licensing on who is allowed to tinker with this little gadget? Is that what we're talking about? Because in another sort of field where you have amputees who have prosthetic limbs, and these limbs used to cost so much money to make, but now you have something like 3D printing that is completely changing that game as far as like people being able to print stuff. So I wonder. So what I'm wondering, when it definitely comes to the cost, I would love to drive the cost down so much that we're not even arguing about insurance, how much premiums are and all that. It's like, let's try to get the cost down as much as we can. I'm not in the field. I don't know how to do that, but shit, I want to do that. I want a $100 earbud that a kid can put in and hear for the first time in his life. So.
Yeah.
I think I forgot my question, but I was gonna. No, he's got a point there. So I was the one that helped Toby with his medical bills, and You're welcome. And I worked in the system, dealing with insurance companies and whatnot, and now I deal in workers' compensation with medical bills and dealing with medical bills as I quote hella fraud because there's a lot of money to be made. And I think that one of the things that we kind of miss when we're talking about healthcare is that for a lot of people, healthcare is a business. So there's insurance companies, do you know how they make profits is they don't pay your doctor's bills. You know what I mean? So there's a dehumanizing section
if anyone's seen The Rainmaker, it's kind of like that.
Right.
Deny.
Yeah, and I have battled with Medicare and whatnot, but the problem with a single payer system with the government taking over is in Washington State, the price of or the payment for a doctor to take bone marrow out of your hip was $12. So is that what you want? So it's a very peculiar thing to say, like it can't be 100% hardline single payer, because I don't want to pay $12 for a doctor to do anything, you know what I mean, other than validate my parking, because like at that it's just like, no, don't touch me, dude, with your $12 shit.
You're a high class sick lady, all right.
And my thing is the insurance companies is where I believe is a lot of problems. They're making a lot of fucking money.
Yeah.
And they're cashiers.
Yeah.
They're cashiers. And you want to talk about slavery.
No, I actually don't.
No.
I know I brought it up.
I do.
I know I fucking.
I want to talk about slavery. I got something to say.
So I relatively, I don't usually go to the doctor. I don't ever, but I have to have yearly mammograms. And because of a very fine point in the diagnosis coding, my mammogram went from diagnostic or from preventative to diagnostic, which means it went from free to $600.
How long was this feel up? Like, how long was second base?
A mammogram. It's a mammogram. So a yearly mammogram.
I don't know. I know what that is. I know what it is, but I think I've done it in high school.
No, he doesn't. You didn't know FDA stood for rules, so I know he doesn't know what a mammogram is.
So here's the deal. It's just like, my boss takes insurance out of my wages, and I still have to pay $600, and my total cost for the insurance company has been less than $1,000 from a year. I would consider that theft for me. You know what I mean? Because I probably it's just this very fine point. I lost my question. But what do you think about taking profit out of the insurance companies or capping it?
Right. Well, since I'm the expert here, I just have to. I'm going to bring up an example. There's a doctor, you probably heard of him, Dr. Jeffrey Singer, who he wrote he's a surgeon, and he wrote this article for the I forget what was it, the Wall Street Journal, something like that, where a patient had come to him, right, and they were going to do a hernia. Hernia operation, right? Pretty standard, unless you've been watching The Nick, which nobody here watches The Nick. Okay, whatever. All right, that one bombed easily. So he was going to do his patient had like a certain kind of insurance, and they were going through all the pricing through this hospital, and it was going to be something I think close to he would have to pay out of pocket something like $20,000. Right, if he was going through his insurance and this hospital and all that, and he talked to this surgeon, and basically, long story short, this surgeon ended up being able to do everything for him in more of what you would call like a free market kind of thing for $3,000. So he saved this guy $17,000 on this procedure, right? So, you look at that, and I hear what you're saying. You have all these vultures kind of like.
You
picking
always
at
have that option to not go through your insurance company. You can go in and say, it's sort of a luxury, I understand. What Quincy's point is like, if you've got $600, but I've bypassed my insurance. Like, how much for cash? How much for this MRI cash? Because I know they're going to fucking eat me because my deductible, well, they're not going to eat me, but sorry about that. Sorry.
That's a little extra cost to a mammogram.
They're going to hose me with my deductible.
You're going to play the salami shell game? Or?
Yeah. But you can't negotiate if you're fortunate enough and it's a small enough procedure, be like, how much is this cash?
Right.
Because the prices are inflated. When we used to do pathology, and that's why people freak the fuck out when they see medical bills. They're like, this hospital bill was $1 million. It's like, well, it's capped so that it'll cover the highest paying insurance premium.
Negotiate down, right?
And then everything negotiates down. But if you're looking at you're uninsured, you're poor Quincy Jones. You're like $50,000, $100,000. I got gum. That's how to pay that. So that's basically what it was.
I want to stick up for the insurance companies a little, which is just that
Always a popular answer.
If we're going to have a system and it basically that involves the patient or the doctor sitting in the room deciding what to do and sending the bill to somebody else, there has to be somebody who's able to say no, or otherwise costs will be even higher than they are now. And if insurance companies don't do that, then the government has to do it, which is how it works in a lot of other countries. And so somebody needs to play that role, and I think the insurers play it imperfectly. But I think often they are, they're the force in the system that's trying to push for cost effectiveness because they're the ones paying the bills. And so I think, that's a necessary component of a system that's going to have any sort of cost control.
Well, honestly, a lot of the cost control is Medicare driven. So it comes down from Medicare. So that's basically a take. And I agree with you. 100%. But it makes it really, there's a lot of bureaucracy, and this is coming from someone that's paid a lot of fucking bills of her own bills, like bar tabs on bureaucracy. So I'm saying it's fucked.
Yeah, no,
there's
absolutely.
There's too much bureaucracy on it.
But I think people will hate any version of that system. And when Bernie Sanders talks about how great his single payer system is, he says two really contradictory things, which he says we'll save all this money, and then he also says there won't be an insurer interfering with what you and your doctor decide to do. And those things can't be true at the same time. The way other countries save a lot of money is that the government interferes on behalf of cost effectiveness. There's always going to be somebody saying, no, that's not a good idea, we're not going to pay for that.
Can I add something?
He's got the microphone.
So I just want to dispel a myth real quick. Insurance companies don't make money from, if you were to net out all the claims that are paid out and the premiums paid in, their goal is to make nothing off of that. That is the goal of an insurance company.
What?
The way they make money is through investments on the premiums that they receive and the time that they hold those premiums versus when they pay out claims. So insurance companies, if you look at most of them, they actually lose money every year paying out more than they take in premiums, and that's been the biggest problem with Obamacare. So I just wanted to dispel that first, but I have a question.
That's true for life and property insurance. I don't think that's true for health
true
insurance.
for medical insurance.
No, because the caps in Obamacare that they have to pay out at least 80% of what they're taking in. It's good. And a lot of what they're doing is administering self-insured plans for employers, so they're not even paying the claims themselves.
Sometimes the government pays, but insurance companies, that's not how they make their money. That's not their business model.
Let's talk about how quick it takes. What's the degree of difficulty it takes for an insurance company to pay out anything? It's not in a timely manner. So while you want to lobby for them, that's great.
Why are insurance companies public? They're not. If they're incentivized. A lot of them are public.
Go ahead.
If you want to talk to, use the microphone.
On the phone. I don't even know what a microphone is.
I do want to just raise the point that, even if their goal was to be cost neutral, they would still be incentivized to deny, claims to accomplish that goal.
Well, they have to pay out what they're legally on the policy supposed to pay out. That's what they'll pay.
Josh, do you want to respond?
No, it's he's been waiting to talk.
No, it's you guys.
No, man, go ahead.
I didn't see you before.
We've been talking enough. I heard everybody.
With the red.
True enough.
And you've been very generous by giving other people a mic, so it's you now.
You got the juice now.
First off, I just want to thank all of y'all for being here to have this talk. Healthcare is near and dear to me. The whole reason I flew out here last week to donate a kidney to somebody from Arkansas.
Oh, shit.
So this is a cool.
You have it on?
No, it's gone now.
Gone? Holy shit!
Yeah, I had the surgery Wednesday.
How much lighter are you?
Not much.
Not much.
Yeah, because I can't do exercises because the ab is.
Because summer's coming up, and
Yeah, no, it's. I looked into it as a weight loss plan. Kidneys aren't real big, man. You got to get a lung or something.
Oh shit!
But
that's great.
But anyway, I've got to address one thing, and I'm not trying to demonize you because this comes up in every conversation, but just this inherent just talking point or inherently just fallacious talking point that gets put out every time we have this discussion, and they go to the example of in these single payer countries, poor people have better health care, but the wealthy people come to America for the good health care, therefore the market's the way to go. No, that's not a counterpoint. You're literally restating the problem we have. The problem is that in America, the wealthy get health care, and especially before the Affordable Care Act, the wealthy get health care, and the, quite frankly, middle class down don't. And so, whenever you come back and say, yeah, but look at all these really wealthy people coming here for health care, you're not defeating an argument. You're affirming the argument. You're affirming the problem. Now, granted,
post ACA, it's not as bad. You know, we had a better option. I think we took the worst next best option that we could have taken. But
or the question could be, you know, why is it that those people in those countries feel the need to fly here to get any kind of coverage if things are going so well?
Well, and
over
so
there, you know what I mean?
Yeah, and so related to that, and I wanted to address one more thing you said. You know, how do you define quality of healthcare? You know, all of these studies. It's not just the WHO. There's study upon study.
It was, but there's a lot of things that are missed in those things. And like,
okay, fair enough. But
like, let's say you have horrible fibrocystic acne, and you're the pariah of your school, and you go to, you know, Canada, and they won't cover Accutane until, you know, you're on the waiting list for 8 months. And so basically, you know, that doesn't affect your infant mortality rate. It doesn't affect your life expectancy. But those things affect quality of life. And so there's a lot more to it. And it's complex. And so anytime you try to reduce it to something really simple, it's not going to work. I mean, that's just the reality. So to put up a straw man for the opposite side, all I'm saying is that if you look at the areas of medicine that do act as a competitive market, so unfortunately those are only basically cosmetic surgery, refractive eye surgery, other like procedures that are like more cosmetic. What do we see? That costs come down actually. Like unlike the rest of healthcare where costs just keep going up, where you pay the same or more for an older technology, which doesn't happen anywhere else. And so you see that advantage. Now, to cover what you're worried about, which is low-income Americans, I mean, I'm totally for creating a type of safety net to cover that. And like, there's lots of ways to address this without having to go to single payer. And if we stay on the current track, I mean, it's unsustainable. And so even the single payer, like you point to the lower cost in like Europe for single payer systems. Well, Medicaid and Medicare function as single payer, but both of those systems pay still way more per capita than Europe does for its people. So you can't just like say, oh, if we all went like...
Well, because they have to,
Medicare
because Medicare covers old people and Medicaid covers poor people, and there's no public option for people in the middle who are healthier and have lower health costs.
And they do have...
Even if you control for age and comorbidity, they still pay more.
Yeah, so people who are older and have had good health care all their life have lower health care costs than people who are older and have good. That's not surprising.
There is also a lot of fraud too with those, which is no. And you know, anybody here from Florida? Woo! You know about that fraud, Medicaid? Yeah, it's
But the other reason Medicare is more expensive than other countries is that Medicare has to pay the same doctors that private insurance companies pay that charge more here than they do in other countries. I mean, people like to complain about the insurance companies and the pharma companies, and we do pay more than other countries for those things. But the biggest cost gap between the U.S. and other advanced countries is in outpatient care, which is really just payments to doctors, basically. More of our doctors are specialists as a percentage than in other countries, and specialists make a lot more money here than they do elsewhere. And I think this is a problem with the Sanders plan and with other, you know, when you say, you know, do like other countries do, we could save some money by looking more like other countries, but we wouldn't save a ton of money without drastically reducing how much a dermatologist makes, which I think would be politically very difficult. And, you know, these people also went and, you know, took out a lot of student debt on the expectation that they would make way more than a dermatologist in Germany. So there is path dependence in the system. The reason, you know, I think fundamentally a single-payer system works better than the system we have in the United States. I think the problems that would be involved in transitioning to a single-payer system are too daunting to make it make sense in the U.S. because people are used to so many aspects of the system that we have now, high doctor pay being one of those.
And so that goes to my point. And I just realized I didn't really make myself that clear. Yeah. But like, yeah, so this kind of false, like, this straw man that, oh, you know, we can't have a government-run healthcare because it creates a two-tier economic system where the rich people get good healthcare and the poor people get bad healthcare. Well, especially before the ACA, we had two tiers. If you were rich, you got healthcare. You got good healthcare. If you were middle class down to poor, you died of a preventable disease because you couldn't get health care. That's two classes.
I'd like to see
now,
the data.
With the ACA, well, I mean, anecdote's not data, but I was passed.
I don't believe that you don't have a kidney. I don't believe that, man. No.
Is this voluntary or like
Actually, it looks pretty hot. But you know, something I was going to say too about Europe, a very interesting point too, is that in Europe, and I believe like countries like France, registered nurses are allowed to perform a lot of the things that doctors here perform. And I think there's been a big pushback too from like general practitioners and stuff of allowing nurses to take on more responsibility and, like being able to identify flu and pneumonia and stuff like that would, send a lot of people into the ER. It's something that nurses can actually take care of, and that would actually maybe bring down the cost too.
Yeah. That does seem like one of the expectations that we have in the system, which is that you see a doctor if you want to see a doctor. But if you're just sick with something basic, maybe it doesn't take 10 years of medical school to figure out what's wrong with you and prescribe a basic medication.
Just go see my grandma.
By the way, I'm going to disagree with one thing with Josh. So there is a logical argument to be made that like single payer would be better than the current. And I think there's actually a rational argument because like right now we have this kind of bastardized hybrid where we get the worst of both worlds. So I guess my argument would be more, I think you could make that a valid argument. I think if we increase more innovation through competitive forces, that's when you get those real breakthroughs that like you were talking about before, where those are the like things where you jump ahead and costs go way down and you make, things way more affordable that used to be more expensive. Like if the government had taken over and centrally planned cell phones in 1980, chances are our phones would still be pretty darn large. Maybe everyone would have the same phone, but it would be a crappy phone.
But we'd all look like Zach Morris. So
but I think innovation comes through incentive.
I agree.
So
the competition does that.
But there's a competition. Like the competition goes from like getting into the school to graduating the school to job placement. So I think incentive would provide innovation, right? Because you keep talking about innovating. I feel like that's the only way to innovate is through incentive. And I guess like the standard, like a dentist, I don't know. That's what it sounds like you're saying. But go ahead. What do you guys say, man?
Actually, it was something you said earlier. You said you had gone to the hospital and they asked you if you wanted to have your blood drawn, and then you got a bill for it later. And the question I had was, do you think that prices would change if people knew what the prices were?
Oh, absolutely.
Just on both sides. I mean, it's like you go there and it's kind of like, oh, here's your buffet of options. And you're like, what does it cost me? Oh, don't worry about it. Then you get that bill later. So
you are 100% right. So like take, for example, the earlier example I gave of like if auto insurance was worth the way health insurance did. Like Jiffy Lube posts how much it costs to get, an oil change, and then people would compete. And so I think like in an ideal world, the majority of people actually would, instead of getting, so about 80% of people get insurance through their employer. That's kind of like the majority in one form or another. So I think most people would be better suited, and the system would be better suited, if rather than your employer withholding 10 or 12 grand in wages, you expanded that tax incentive to just give you wages. You buy it at a catastrophic plan, so you have higher take-home wages, your premiums are lower. Yes, you have a higher deductible, but now you'll basically shop around with it because it's coming out of your pocket. So you say, hey, what do you offer for this? Oh. So I think you're totally right. If you had, and one way to do that is also if people had, we may even get this through Obamacare as deductibles are just like skyrocketing.
You know what would happen if they actually gave you the options? Oh yeah, you want to get your blood drawn? Yeah, I do want to get my blood drawn. It's going to be like $300. It's going to be $300 to get your blood drawn. Oh, do I really need my blood drawn, or is there another way we can go about doing this? That's what the conversation would be like. And people would be trying to avoid getting their blood drawn when they might actually need it, though. So, that's what would happen, to answer your question.
So this is to kind of go back on what both of you guys are saying. So that's true that, studies have shown that patients actually don't make good decisions, cost-effective decisions, or decisions that improve their mortality. When you look at patient satisfaction specifically, so when you talk about like something that's market-driven so people can make better decisions for themselves, when you look at patient satisfaction scores, there's large studies that have looked at patient satisfaction scores, which Medicare, reimburses people for having better patient satisfaction scores. Having a higher patient satisfaction score is actually associated with worse morbidity and mortality, and it's also associated with higher costs. So happier patients who want more things usually, right? They don't necessarily make good decisions. So if you tell someone like, do you want this blood test or not, you might not be able to make that decision for yourself. That being said, there's a lot of times where some of these things are not exactly optional, right? So if you're using this car insurance and if you want your car detailed, do you want the premium or do you want the basic? for a lot of patients, this isn't really optional. This is your life that's on the line. So some of the most expensive treatments that are available are not optional for patients. They can't shop around, right? The peritoneal mesothelioma treatment, there may only be, one study that's out there about it. There may be a tiny cohort. There may be only one drug. And so there may only be one company that's making it, and you can't price compare, and it might be astronomically expensive. Yeah. So the people are not cars, and their lives are not making decisions about detailing.
Medical school.
Yeah.
I don't like that analogy because I don't have a car.
Yeah.
But what about Transformers?
They're
my best friend is
right. They're people and cars.
Okay, thank you.
Yeah.
We've established that.
I think though that the way that this stuff can work with the price comparison is when insurers do more of it. And we're starting to see stuff where, insurers will come to you and say, hey, I see you're scheduled for this MRI. Can you go to this cheaper place and we'll kick back X number of dollars for you because you're doing this more cost-effective thing. And then also with changing the way providers are paid, where they're paid not just for providing services, but for producing better healthcare outcomes. That encourages the providers to be mindful of this stuff. The providers are in a better position to do this sort of cost analysis than the patients are. So I think, these data do matter, and transparency in them matters, but I think it's not necessarily the patient who is going to be the best person to be reviewing the data and deciding what to buy.
One thing I wanted to touch on real quick, because we got to leave in a few minutes, was we talked about it briefly, but preventative care and the government sort of using calorie counts and stuff like that to influence consumer behavior and try to encourage us to make healthier choices. Do you think that's an effective way to improve the healthcare costs long term, or is that just sort of not the role of government, or what's your take on it?
I would agree. If you had more actuarially fair insurance as a general rule, you would shift behavior more. Like people, kind of like you were talking about before, where you don't tend to moderation, people overeat, they get obese. Mm-hmm. People tend to be more motivated by their wallet than by their health a lot of times. Mm-hmm. So if you, going up to 300 pounds was going to triple your premiums, you would probably more incentivized to actually drop the weight than if you basically don't do that.
Well, I didn't know that's where you're going to go with it. I was like, yeah, I agree. And then you went there. I was like, oh, no, I don't agree with that. But I do feel like, Toby, it's a step. Mm-hmm. It's a step in a direction. But America doesn't give a fuck about its health in general. Like, how many times, we all seen what Coke did to the fucking car battery, like, when we were kids. We still drink that shit. Like, we know what fucking McDonald's chicken nuggets are made out of. We see the video every 5 years. We still eat that shit. You know what I'm saying? We all know that Jack and the Crack tacos aren't good for us, but we still eat that shit.
But nobody here knows what that Tampico shit does to you, though. Nobody.
Gives you cancer, though.
Oh, shit. I want to see that lawsuit, Quincy.
But I think, in theory, it would be good to sort of be like, yo, okay, listen, we're the most obese country. We're overweight. We're out of shape. We're not leading anything. We got to figure out how. Like Michelle Obama tried to do the active kids thing, right? We try to do that, and that's, I guess, somewhat working, to get kids more physical. But I think, to stop, or at least fucking tax the fucking companies that are doing heavy advertisement placements, or vending machines in middle school, right? You know what I'm saying? That was a big thing when I was growing up. It was they had a vending machine for for soda, right outside the fucking gym. You know what I'm saying? We're finished, we play hoop, and what are we going to quench our thirst with? Not water, but Sprite. That was the thing. And I was like, what? It didn't work. But
guzzling Sprite is painful.
But that's what it was. So I feel like it maybe, but I guess America needs to stop trying to pinpoint everything on one thing in particular. It's not any one person's fault. It's a whole system that's fucked up. And everybody needs to do their part, and everyone needs to agree to change something about what they're doing to participate in the system.
This is what I like about America. I went to a buffet in New York.
Quit bragging, dog.
No, I'm just telling you.
It's hard to be on your Canadian wealth.
Yeah, I had some money, went to a buffet, and this guy stepped outside, puked, and then he said, round two. I thought that's why I love your country,
but
man.
America
Go
doesn't
get
give a fuck, son. Fuck about our health.
I do want to say I'm not as pessimistic about Americans' health outcomes in terms of our obesity rates are declining. We are eating healthier now than we were 5 or 6 years ago. We're no longer the most obese developed country in the world.
Dude,
Who is?
I just came back.
Mexico.
Is it Mexico?
And Dubai and a lot of the Middle Eastern
I
countries
just
are
came
much
back.
higher.
Well, all the Indians working in Dubai are not obese. Am I right? I just came back from England. Holy shit, man! The English put on some weight.
They're the fattest country in Europe.
It's funny, the study I mentioned about how life expectancies for the poor vary across parts of the country. How many poor people have health insurance was not important for driving that variation. The really important stuff for driving that variation was lifestyle factors like this, smoking rates, obesity. Also seem to be some effects from state and local government spending on social services. So those seem to be, I think we spend almost this whole time talking about health insurance. People get very emotional about health insurance. People care a lot about having health insurance and having good health insurance. And it matters financially, and it matters for people's state of mind. It's really hard to find in studies how much it actually matters for health outcomes. They did this big study they expanded Medicaid in Oregon. They couldn't show improvements in physical health outcomes. Now people say, well, the sample, though it was large, wasn't necessarily large enough to pick up the effects. It doesn't mean that having health insurance was worthless for physical health. But the effects are just not as large as you might think they are, given how much time we spend worrying about it. And so I think, it would be good for Americans to spend a little more time worrying about, are they eating well? Are they maintaining a healthy weight? Should they stop smoking? Because cigarette taxes really seem to work. If we had higher alcohol taxes, I think we would have significantly lower rates of drunk driving and alcohol-related illness. Like, these lifestyle decisions really matter a lot for life expectancy and health outcomes, and we don't spend nearly as much time thinking about them as we think about medical care.
We have another question from the audience.
Yeah, I know we're kind of wrapping up here, but I guess I have a question. What do you think the public response would be? Anyone can really answer this. If we do move to more toward a single payer option or more toward like a more socialized sort of scheme, and then people are still doing exactly what you're saying they're going to do. They're going to keep drinking 10 bottles of Coke a day or whatever they're doing. And then everyone is more responsible for the cost of that. And it's even happening now to an extent with people, going to emergency rooms and things. What do you think is the response there? Do you think there's just like shaming and that will shame people into being healthy, like in addition to like more taxes? Or do you think then government would step in and say, no, here's like our recommended diet and here's what you're going to have to do?
I don't think the government will ever do that. I don't think the government will ever step in and advocate what we should, what's best for us.
Isn't that what the food pyramid is? Like,
I mean, how long ago was that?
The food pyramid isn't about food.
Yeah.
Well, right. But I mean, isn't that the point? Like, it was meant to, like, just, here's a recommendation of what.
But I mean.
But exactly, and isn't exactly the fear. Like, it could be wrong. Well, yeah, but isn't that a valid problem?
It's government, but diet is one of those tricky things that I don't think we're going to ever have conclusive data on because the way to get it is too hard. So that's why you're going to always have like the fads, like kale is the best. Oh no, it causes parathyroid cancer. But I think.
Wait, kale causes cancer now? Is that a thing?
Quincy.
Kale, high doses of high intake of kale has been linked to increased risk of parathyroid
shit.
cancer. But again, like everything does. Like.
Wow, Venice Beach is getting fucked.
Starvation does a lot of harm.
All you people juicing.
But I think if you did like instead of a cigarette tax, if you allowed you could do a cigarette tax. Another way of achieving the same outcome would be you have actuarially fair premiums. So like if you're a smoker, your premiums will be higher. If you
they already are.
That's actually one of the few things that can be discriminated against under Obamacare. Most things cannot. That's one of the few things that because it's politically unsavory, they allow that.
And the president's a smoker too, so you guys didn't know that.
Yeah.
I mean, but all this
Actually,
time
he's
thinking
quit.
about the lobby.
Did he quit?
Yeah.
I don't know, man.
He's a vapor.
Nobody's seen him.
Wait, all right. Wait, ma'am. What's your name again?
What's my name?
Yeah.
Lana.
What was your question again?
My question is, what do you think will happen if we do have a system that moves away from like kind of private options and more into socialized ones, or more into single payer potentially, to like the diet of Americans? Like,
well, also sort of like in our basic interactions and relationships with everyone, where it's no longer like you're living your life, you're making your choices. Now it's more like you're living your life, you're making choices, I'm paying for your choices. Knock that fucking cheeseburger out of your
exactly.
mouth. We're already there, though.
But America hates change, period. America has always hated change. Like, it hates change. And then, like, thank God we're in immediate gratification generation where it's like, we'll squawk for a little bit and then it'll just die down.
That's what would happen. Any major change in America, people would be like, what? I hate this change. Okay, and then they'll move on. Because America doesn't care about anything because we don't understand most of the shit that's going on. I have cancer. I just went to my oncologist appointment today. I still don't know what he said to me today. That was this morning. So like for me, it's like I Google I read everything. I have a master's. I'm not dumb, but I still don't know what he said because I listened to this guy and realized I don't know what he's saying. So it's like I don't know, like the jargon that doctors use is not ever really clear to the average person. Maybe you guys understand. Maybe you guys are smarter than me. I'll be a person, but like they don't break it down for you. And so what needs to be done is like better communication between doctor and patient. Look, here are your options. Okay, here I know you can't afford this, but I'm going to tell you what your options are anyway. Sometimes doctors don't tell you the option outside of your price range because they don't think you can afford it. You know what I'm saying? They'll be like, oh, okay, you can either do chemo or you can do this surgery. What they don't say is if you really want to save your life and if you have any way to do it, you could go to this country and they are leading the way on how to beat this disease. But they won't tell you that because that's not in their best interest because the money's in the treatment, not in the cure. So America will always continue to just be like, yo, I hate this change. This is bad. I don't like it. And then another thing will come along and we'll protest that. And then that's what would happen. To answer your question,
I don't think that the cause and effect of insurance reform and the day-to-day health decisions that we have, I don't think they're that connected that people are gonna, be like, oh, my healthcare is taken care of, so I can eat, cheeseburgers, and they would just forget that, it's gonna have a physical effect on them.
Yeah, so that's actually the inverse, I think, of what I'm asking. Like, do you think other people will feel like they have control over your choices?
Okay.
Oh, absolutely.
Yeah.
Politically, like, if it becomes single payer, so everyone is involved, like you said, like, when a person when you have a child and you pay for everything, you're also the parent and telling them what to do. So if you did that, trust me, you'd have a ton of, think of the big hoopla over drug testing for welfare recipients and all the infighting. I think you'd have that and even more because suddenly everyone would go, well, I'm not paying for their health insurance if he's going to be doing this, and I think that would totally happen. And then you get the special interest get in. So one industry under the guise of being a benevolent helper of the people will say, you know what, our competitor puts out a really dangerous product, and I think we should tax that, or it'll become a special interest free for all, where one company tries to get their competitor, and again, they always have that bootlegger and Baptist economic model where the Baptist, kind of during Prohibition is the face of benevolence, and then they have their ulterior bootlegger motive, and they're basically just trying to get a competitive advantage through the guise of government restrictions.
So wait, a purely competitive market would not have all sorts of contradictory sort of interests competing with each other and putting out misinformation about each other? When actually the question of
the difference is using the power of the law versus free competition. That's the real key difference. So under your system, you want people to basically be aligned with government and use the power of the law or force to coerce things. So whenever one business, let's take for example, Walmart a lot of times likes to posture as this. I actually think they're a great company, but they like to posture as more benevolent by saying hey, we want to advocate for the government making it mandatory that retailers such as us provide health insurance or raise the wages, and they get the virtue signaling brownie points from that. But really, what they want is, since they already get flack for all these types of things, they just want to force that on their competitors, and since they now will have the lower overhead, per retail area, it's going to now give them the advantage by linking it to the law.
Well, they've been living off of
Miami. Do you have something you want to say? Yeah. Because this will be our last one that we got.
Yeah. Okay, wait. I just have this one question I've been dying to ask.
Wait, we could ask. She's waiting. Can we ask this outside? When we? Miami. You have something to say,
and then we end.
Okay. Yeah.
No, you should ask.
Let's have you two ask the questions, and then we'll go around and we'll each say something like a closing response, and you can address the question if you want.
Okay, the simple question that's been kind of killing me not killing me literally, but sorry, is what is a purely market-based solution say to Quincy? Purely market-based, no government support, no nothing, say to Quincy right now with his situation, his condition? What does a purely market-based solution say?
Well, first of all, like charity can be a part of a market system. So what you're trying to do is load the question by assuming basically a narco-capitalist state and say, well, under that situation, what about Quincy? But you basically, implicit in your question, you've ruled out charity, you've ruled out that markets can generate safety nets. And so I think...
And so can people through combined action of government.
I mean, the way that I look at it, I think a market-based system would be giving Quincy the greatest blowjobs every hour of his day. I think that's what I would be doing, treating him well.
See,
I'm not good at it.
What's stopping you now?
I suck at it.
There's no regulatory barriers.
He's not into it. He's not into it.
Suck at it. You're doing
Maybe
it.
market-based isn't that bad. Come on down, Miami.
Okay, so I think that tonight we've seen played out a really interesting thing that always happens in this debate, which is that there's a really high-level argument for market forces, and that gets lost, I think, in the everyday narrative. Because I see you guys getting frustrated, and I hear the audience getting frustrated at some of the things that are being said. But like, what's lost is what you said earlier about things happening over time. The markets affect things over time in a way that we can't see right now. We can't, like you said, Americans want to just think about it right now, flash in the pan, and then it's over. But like, we don't, like, something that we don't see that's happening over time is that this guy right here, he could take a flight for hundreds of dollars because of the free market, because somebody, because of the American, system of how we had freedom to the point that like we invented flying, and we were able to over time create a big market where there's a lot of different competitive airlines, and that way that drove the cost down. So now it's not just rich people who get to fly; like a lot of other people can too. But so I wanted to make that point because I think that people are getting emotionally frustrated at some of these arguments, but at the same time, you have to think about what happens over time. And, that is a really big factor. Like, it might not affect you today, but it's going to affect you and it's going to affect your kids long term. But my question actually had nothing to do with that debate. I wanted to know what you guys think. Earlier you were saying a lot of the oncologists who are experts at at your particular condition are in Baltimore. I wondered if anybody knows what electronic medicine is doing to help that. Like, my initial reaction was like, can you Skype with them? And can someone send them? Because I think that's a real thing that's happening right now. Like, you send tests, it's like your doctor here sends them your test results, and then they can look at it. And it's like telemedicine. What can that do to change this problem?
Yeah, Quincy, have you been doing stuff like that?
I mean, yeah. Like, I mean, again, it's the county, so they're heavily regulated, and they're not like really trying to help me actively get some. So I have to do all the legwork myself. So I have to go and request the files. And that takes 2 weeks in the county. I have to request the CT scan and the disc. So that takes 2 weeks, 2 weeks to 3 weeks for each one that I request. So I have to send it out to multiple people. The best peritoneal specialist in mesothelioma is Dr. Sugarbaker in Baltimore, Maryland. And he doesn't take on every case, even with money. And I have money to do the operation, but he's concerned with his success rate. You know what I'm saying? He stays the best by taking on the most ideal cases. My case isn't ideal. Same way for lawyers. Most people, when they see the commercial when they see the commercial late at night for like calling someone, they can usually pinpoint where they got exposed to asbestos. For my disease, it's 20 to 50 years to show up. And it usually hits people when they're, 65 to 75 years old. So for me to find it in 30, 31, you know what I'm saying? Like, it's a rare case. You know what I'm saying? Especially since I've never been exposed to asbestos. Long story short, to answer your question, is you have to do the legwork and then sort of like see if they'll accept you and then go out there. I went out to see one mesothelioma specialist, cost $350, not including the airfare, to just see the doc, and then he's like, I need the disc. I was like, well, why didn't you say that before I flew out here to see that? You know what I'm saying? And it was stuff like that. I was like, why did I come out here then? Like, I messaged you, I talked to people through the foundation, I did everything I was supposed to do. Why did you not tell me that? Why did he not tell me that? Because it's in his best interest, because his office just made $350. Period. Now, I'm not saying $350 is a lot, but if $350 from each person trying to save their life, that adds up. So I don't know why he wouldn't do that, but I think like you do have to do a lot of legwork, and doctors won't Skype with you. They won't do that because they're busy. or they don't care enough because there's no incentive for them to Skype with me.
And arguably because of regulations and liability.
Okay, let's go around and do like a closing statement. Just if there's anything you wanted to get off your chest or some way to sum it up. Go around.
Yo, I want to say that this has been, I appreciate everyone coming out. Thank you guys. Thank you, audience, for sitting and listening to this banter and give it up for yourselves. Give it up for Toby and Lou. Give it up for our guest specialists, man. I definitely think everyone here can work on analogies, though. I really want to say that. Everyone here is horrible with comparisons and analogies. That auto one lost everybody. Everybody was like, what the fuck are you talking
The
about?
gypsy one, too. Was there a gypsy one?
No,
it was the baker.
There was no gypsy one.
No
But me and Dave and over here talking about gypsies.
gypsies so much.
But yeah, I mean, but thank you guys. I mean, it's good to know what people in the industry are, how the thought process goes between like the free market and whatever else you guys were talking about. So.
You want to sit in?
Sit in or hey man, thank you for letting me say minimal things. I had a good time. I understood half of this. I'm not gonna lie, I didn't understand anything. But I did like when you guys got heated, the air conditioner came on. Every time you guys got heated, the air conditioner started, and I knew you guys were gonna get heated because it started before you got heated. So I appreciate that. Yeah, that's it. And I'm really excited not to get healthcare in America. And hang out, not play basketball, and have milk duds when I leave. There.
Okay. I guess I would just say I think that I think the free market does work well to bring down the cost of optional goods, and I think one of those optional goods is elective surgeries, like LASIK or like cosmetic surgeries that aren't crucial to people's lives and survival. I think when you get into stuff where it's, do or die, quite literally, then that relationship breaks. And I think that's also exacerbated by the fact that people don't know a lot about healthcare and they don't make great decisions on it because it's really complicated and not many people understand it. And you need a degree to understand it, so people don't have a degree. They're not going to make the best decisions. And you're not going to have all of the same regular market pressures that would bring down costs. Also, I think that... whatchamacallit. It also, because that lack of understanding, I think, is something you also see in stuff like the housing market when people have now incentives because they know you're not going to understand things. They have the incentive to push you into things that aren't necessarily ideal for you. Patients are happy, they have higher satisfaction, but they have worse outcomes. People like having big houses, but they don't like when their interest rates. They don't like when their interest rates skyrocket and they lose their houses. So that's basically all. Yeah, Liv.
I would just say I think people. It's really hard for people to make good financial decisions when they're worrying about whether they're going to die. And I think and especially when it's a complicated financial decision about a thing about which they have very little expertise in. And I think that's part of why health expenditures have gone up so fast relative to the economy. It's been a very difficult place to find efficiency, to find improvements, because it's very difficult to have good decision making. And when you remove things to anonymous bureaucrats at insurance companies or at the government, often those removed parties have, at the macro level, very good judgment. Now, people don't like having the judgment removed from them, and also they don't make the right decisions at every turn, and so people can point to things and say, you made anonymous bureaucrat, you did a terrible thing. But I think just sort of trying to return decision making into the room with the patient often ends up leading to worse outcomes than you'd have otherwise.
I guess, again, when you consider healthcare, it's important to remember this is complex. There is no one size fits all. Any law you pass there's always going to be losers and winners from it. And so I would just urge to don't fall for the simple answers that politicians love to give. They love to give, I think Bernie's the worst offender in this current election, who promises the moon and really no clear way to pay for it. So avoid the easy answers, and again, look at how competitive markets have done so well in so many areas. And we're not going to change it overnight, but if we could start moving towards a more competitive system, we can leave the safety net in place, but start to get more competitive pressures so that, again, when you go to the doctor, it's like, hey, I charge $50 and my physical includes all these blood tests. if you look at the areas that are now starting to go out of pocket in response to the ACA, you'd be shocked at how low some of these costs are. Like you can get labs for $5 at some of these places. So, I think we actually may have a free market workaround already in place to avoid the ACA.
I guess what I'd like to say is I'd like to thank everybody on the stage and on all of you for coming out. One thing that I hope everyone sort of realized as we were going through this is that healthcare, like so many other topics, is stuff that we can fiercely disagree with one another. But one thing that I don't think we lost here is our humanity, and that we're human beings talking with each other and disagreeing. And everyone here, I think, wants the best for everybody else and themselves, of course. And today was a special night for me because when I came to Los Angeles like 3 years ago, I met Quincy, and we did open mics together. And the comedy community really has come together to celebrate somebody who is so special for all of us. So it's a real honor to have Quincy here tonight, as well as all of you. And thank you so much for helping us out. Really appreciate it.
We always get drinks afterwards at 3 clubs if you're interested.